And now we'll move on to Dolores, who has a great story about her suffering for 20 years with plantar, over 20 years?
It was actually 30 years.
30 years of suffering with plantar fasciitis, which is an excruciating foot pain problem on the bottom of your foot. So I'm going to let Dolores tell us her story about her plantar fasciitis and what she had to suffer through until you came to this office, right?
Right. Yeah, it was like 30 years ago. I was really suffering. I walked barefooted a lot, and we had hard floors in our house, and it was started back in the 1980s, and I had just delivered a baby, and I was really sore on my foot, and I went to a doctor. He was actually a friend. He was a podiatrist, and I waited a month after I delivered her that I was going to go get my foot taken care of, and so I saw this friend, and I won't mention the name, but...
this is a doctor, you mean?
A podiatrist.
A podiatrist, okay.
And I went to see him, and he gave me an injection in my heel.
Did he tell you had plantar fasciitis?
Yes, he did.
So you had bad plantar fasciitis, by
Really, really
painful.
bad, really severe. And that shot hurt so severely. I don't know if he hit a nerve or what, but I told myself that I would never, ever get a shot again in my heel. But
that was a cortisone shot?
It was just a cortisone shot. And he did set me up with orthotics and special shoes and the whole 9 yards. Splints and...
Did insurance pay for that, or did you have to pay out of pocket for all that stuff?
Well, it paid some, but I paid a lot of money for...
So you had a lot of out-of-pocket expense?
A lot of out-of-pocket expense.
Hundreds, thousands of dollars?
Probably came to almost $1,000.
That was just for your first treatment?
First treatment. And, after a while, it all came back again. And
so you came back to where you were before you even got treated.
Right.
So you had the severe pain.
Severe.
You had this treatment with a painful injection.
Right.
Almost $1,000 worth of special orthotic shoes.
Right.
And your pain came right back.
It came right back. And
so then what did you do?
Well, I just suffered because I would never see another podiatrist because I said to myself, I'm not going to go back and have a shot again.
How long did you wait before you saw somebody?
Well, I kind of walked on my tiptoes because...
For how many years?
For over 10 years. And
you just suffered with more severe foot pain.
Right.
Not seeing anybody for another 10 years.
Right. And a girlfriend of mine, she was suffering the same way. And so she saw a podiatrist and she got an injection and she said, "Oh, Dolores, it didn't hurt." And I said, "Oh, there is no way I would ever see another podiatrist." And she kept telling me it didn't hurt. And she actually told her podiatrist about me having such severe pain, and he said, "Well, bring your friend in. I won't, hurt her." And I just couldn't hardly believe, she, had such little pain. And
so you saw this gentleman?
So I actually went in to see him, and I was amazed that he didn't hurt. And
did he inject your foot?
He injected my foot, and it was...
Did you get more orthotics or special shoes or anything?
I got everything again, more orthotics, medication and...
Taping?
Taping, and he actually did, I think, a laser treatment and, everything all over again.
So was that more $1,000 or more, over $1,000?
$1,000 more. And
did you get any lasting benefit from that treatment?
No. And this lasted another probably 10 years. And I thought, wow, this is ridiculous.
So now you're 30 years into your plantar fasciitis.
And so I wore my shoes all the time. I never walked on hard surfaces. And so then we came down to Florida, and I was at the Y, and I was walking in the pool, and I was at water aerobics, and the swim instructor noticed that I was walking on my tippy toes in the pool, getting out of the pool, and she said, "Are you suffering from plantar fasciitis?" And I said, "Yes." And she said, "I noticed you weren't walking flat-footed." And I said, "Yeah, I'm suffering something terrible." And so she said, "You ought to go to a doctor." She says, "I know a really good doctor. He's the best podiatrist here in Sarasota." And I said, "Really?" And so she gave me his name. I said, "Well, if he's the best doctor in Sarasota, I might as well try him." So I went to him and, spent all the money all over again.
Was it the same kind of thing over again?
Same thing all over again.
Some more thousands of dollars.
More thousands of dollars.
And did that provide you with any relief?
Well,
lasting relief?
It did for a while.
What's a while? A few months?
Probably a few months. And then I started having pain again. And then he said, "I think your problem is not going to get cured." He said, "I think we're going to have to do surgery on you."
So again, like Nick's knee, who they recommended surgery for, this podiatrist recommended surgical treatment for your plantar fasciitis.
He did an x-ray on me, and he said, your fasciitis is so bad. He said, "I think we're going to have to do surgery on you."
And you'd had it now for 30 years.
30 years. I said, "I've dealt with this for 30 years. And I said, I think it's about time I do surgery." I said, "I can't take this any longer."
So you were going to have the surgery?
I was going to have surgery. And I said, "Well, I think I'm going to have surgery because I can't stand this any longer."
And did you have the surgery?
No.
What happened?
I said to him, "Well, I think we are going to schedule it." So I actually told Nick, I said, "Nick," I came home and I said, "I think I'm going to have surgery." And I actually scheduled the surgery.
Yes.
And then we actually did schedule a date for it.
I believe we did, yes.
And then
I read the posters in here again about that you could get it in her.
Now, were you already coming here for headaches?
yeah, then I made an appointment and I came in to see you. I guess a regular appointment to see you. And then Nick came in with me and he read your poster. Right?
I think you told me that you were going to have surgery for plantar fasciitis,
Yes.
didn't you?
Yes.
And what did I say?
You said you're crazy.
Yeah, because why?
Because you can do PRP on your heel.
Without any surgery.
Right.
And that the failure rate of plantar fasciitis surgery was very high. I remember telling you that.
And I said...
Because it is.
Right.
And this was a simple injection, pretty much like Nick's knee. I explained to you that the PRP was a simple one injection and let it heal, right?
And I said, "You mean you can do PRP on my heel and not do surgery?"
Yes.
Right.
That's correct.
So I said, "What, a needle or a knife?"
No, just a needle.
And I said...
Just a simple injection. Pretty much like Nick described a simple injection in his knee.
Right. And I looked at the two options, a needle or a knife, and I said, "What would I rather do?"
Right. And so you chose to go with the PRP. Right. And you canceled your surgery.
So I canceled the surgery.
So tell us about your PRP experience. What was that like? Was it like Nick's?
It was wonderful.
You come in and we draw all the blood out of your arm.
Right.
And we go make the PRP in the PRP lab that we have.
Right.
We come back.
Right.
And was it, as I promised, it was a simple one injection in your foot?
It was one injection, and I was very careful.
And the injection took about 15 seconds.
15
right?
seconds.
And you were done. That was the actual treatment portion was only.
And it did not,
Less than a
it was
minute.
a little sting. It was nothing like what I
That
got.
cortisone injection?
Yes.
Not even close.
No,
In pain level?
no,
Okay.
it did not hurt. I mean, it
So the
stung.
PRP injection didn't feel like delivering a baby?
No.
Okay.
No.
I just want to clarify.
It did not feel like delivering a 12-pound baby.
Good. Well, I'm glad to hear that. So after you got your PRP injection, did you have to do anything special?
Well, I had to be careful and, not really overdo it on my foot.
Well, because your foot already hurt before we gave you the
Right.
PRP. So your plantar fasciitis didn't suddenly go away.
No.
So was that tell us about how that went over the next 1, 2, 3 months.
It took probably about 5 or 6 weeks before it completely went away.
So actually in 6 weeks, your pain completely went away.
Completely went away.
After 30 years of suffering with
30 years.
severe foot pain.
30 years. And I am...
From a single PRP injection.
Right.
Wow, is that amazing? Were you
It
amazed?
is amazing.
Okay.
So good that I want to hug you.
Okay.
Thank you.
That's wonderful. So I don't remember when that was exactly. Was that about a year or two ago?
It was about a year ago.
Okay, and has your foot pain ever come back since
No.
then? And do you wear orthotics or wear any special shoes or anything?
No.
So I didn't have you buy a bunch of expensive
No.
stuff.
Right.
You had
Thank
one PRP. Oh, you're most welcome. Thank you for coming in and sharing. But so now you can wear regular shoes. You can do whatever activities. Are you walking on your tiptoes anymore?
No.
So that's all gone.
It's all gone.
So would you say that your life has pretty much returned back to normal without the foot pain?
Yes.
Great.
Thank
Would you
you.
recommend, most welcome, would you recommend that to other patients or your friends that have plantar fasciitis?
I have recommended anybody that talks to me, I've given out your cards. I tell anybody that has the problem, please get it done.
Don't have surgery.
Don't have surgery.
Okay. Well, that's wonderful. I want to thank both Nick and Dolores for coming in today and sharing their really amazing stories on platelet-rich plasma therapy and how they both avoided the knife and the potential complications and the lasting pain from having surgery or getting your whole knee replaced with an artificial knee. So thank you both so much for coming in today. We really appreciate you sharing that with everybody that they can hear your story.
Thank you.
If you feel that you may be a candidate for platelet-rich plasma therapy, I encourage you to call us here at Sarasota Neurology.